Pandey then presented a girl who had a totally paralysed flail right leg and has been crawling for years. He has pioneered an operation where the joint surfaces in the knee are fused, creating a stiff leg. This allows the child to weight bear on this leg like a stick. This helps the leg to grow more normally, and the child does not end up with a shriveled small limb. He has done several operations like this, all with full success. More recently, Dr. Rajinder and trustee Dr. Tej Kamal Kalra and Honorary Secretary Dr. Chopra also visited the home and were delighted with its progress. The children enjoy putting on a welcome dance for the visitors. They also toured the wards and were introduced to some children undergoing treatment. This is a case of post-polio legacy, where due to weakness in thigh muscles, this girl could only walk with a hand-to-knee gait. Now, 3 weeks after a one-stage tendon transplant, she can walk without holding her knee. Here is a case of neglected rickets with severely deformed and bent legs. Professor Pandey explains how he is going to manage this case.
Procedure, she will be operated upon in one stage, one side, in which the fibula will be osteotomized at two places, tibia will be osteotomized at several segments, and then piece by piece it will be aligned in a vertical fashion, piece by piece. You can say a Sikh kebab like operation.
Over the years, there has been a change in the type of cases attending the home. There are no longer many cases of post-polio deformities. The majority of cases now tend to be due to congenital deformities or cerebral palsy. Physiotherapy is an essential part of the rehabilitation process, both before and after surgery, or even on its own. Many children are admitted with fixed crossed legs. If admitted early, this can firstly be treated by a series of casts, and then by separating the legs across the end of the bed, as seen here. Although surgery will still be necessary, it will be simpler and less traumatic for the patient. This is 4-year-old Ranchi. He had an operation to correct his crossed legs 1 month ago and will be in a cast for 1 more month. This child had his cast removed last week and no longer crosses his legs. These children all suffer from club foot. Although they are mobile, as you can see here, they have difficulty in walking and are unable to wear shoes. They require extensive physiotherapy before any surgery. This child, Raj Kumar, has recently undergone an operation to correct one club foot and will later undergo an additional operation to correct the other. He continues to study and write stories whilst rehabilitating. Here is a 5-month-old baby girl with severe club foot and congenital contractures of her fingers. Professor Pandey explained that these deformities are easier to correct the earlier they are presented. This is 9-year-old Uma with a polio-affected weak left wrist. In her present state, she is unable to grip with her hand.
At the moment, you see, leave it like that. Her hand is like this and she cannot grip. पकड़ने की कोशिश करो, जोर से दबाओ. She can't grip. So she's going to have an operation to fix her hand in this state. And then अब पकड़ो, खोलो, हाथ खोलो, पकड़ो, फिर खोलो, पकड़ो. So she'll be able to have some sort of grip.
She will undergo her operation next month.